that. So happy that the conference committee chose Nashville for next year's conference. We've got the governor has already started boasting about what we're going to be doing for the Nashville economy next year. So I'm so pleased that we're able to have that here next year. So everybody who is part of the Clinical Consultation Network lives in the Nashville area should be able to attend next year, I would hope. But we hope that everybody will attend this year as well.
Mhm.
Kind of get warmed up, get
Yep.
ready. All right. Well, we are 12:36. I got to get us going here. This is the Clinical Consultation Network. As you know, we do this every Tuesday at 12:30, but this is a special Tuesday because on the fourth Tuesday of the month, we do our NAD feature. Here with me today, I have my co-host, Juanita St. Croix, our producer, Babs Tierno. The CEO of NAD is here with us today. Also, she just went off screen as I was introducing her there, but Jean Farr is the CEO of NAD is here today. And of course, our guest is Janice Wolf. This we figured out is Janice's third time being on the CCN. So she's got two more times, and we will honor her for being a five-timer once she comes back two more times. And she's really ratcheted up the list here pretty quickly. So I'm very glad to have her here today, and we'll get to meet her a little bit more here in just a moment. Go ahead, Babs, and we'll make those announcements real quick. Like, okay, was I supposed to say something about that slide, or did I thought I already said that. So
You did. My computer froze and wouldn't let me
okay,
click the button.
okay,
We're
I
good.
got you,
We're back
I
in
got you.
business.
All right. So next Tuesday, it's going to be a really interesting presentation. Katie Powers is a friend of mine. We've been working together for many, many years, and she's got a person that she's working with that is having some difficulties. She's had some catatonia and has gotten past the catatonia, but is now having trouble with manic symptoms. And so we're going to just talk about that case next week. And so several people from the agency and from this person's circle of support will be there to discuss this case. I hope folks will be able to join us for that. December 6th, we've got a returning guest. You might remember a few weeks ago that we had Dithu Rajaraman here to talk about trauma-informed ABA. He's going to be back on December 6th to talk to us about that again. He's also closely connected with Greg Hanley, who is doing the keynote speech at NAD. And so he was a student of Greg Hanley's and actually helped me get in touch with him during this period where we were trying to get Greg on board. So he's a great presenter. I hope you'll join us for that. And then December 13th, we're still working on that one. So we'll let you know more about that later. And I've already introduced our speakers. So today's Get Smarticle will be presented by our co-host here, Juanita St. Croix, or Juanita Baker St. Baker St. Croix.
And there's
I can't get it right.
in names.
You remember Zoolander where he's like, woo, woo. I can't get it all straight there.
Okay. I actually think you gave me a good idea to switch it up regularly. So,
Go back and forth. Yeah.
I like a mystery. So that could be fun. But well, thank you for
Juanita,
that.
of course, married Dan Baker, who is a former president of NAD and a great stalwart member of NAD.
Okay.
And Juanita is all as well, and they have unified and been married. So we're so happy about that, and so we were teasing around there a little bit.
Well, thank you. Yes, we're also very happy about it. So, so that makes all of us. But this is my well, it's not my very favorite part of this because I love when the speakers come on. But I love that that screen with Get Smart. He was so big when I was growing up, and we watched him all the time. It's just fantastic.
All
thing.
these young people though are saying, what in the
Who?
world is that? We've never even seen that before.
Oh my goodness, Google Maxwell Smart, go on YouTube, hilarious show. Very dated now.
Missed it by that much. Was that his catchphrase?
Yep.
That's right. Very good. Very good, Babs.
Believe
She's
20. So,
yeah,
yeah.
there you go. And
Yeah, it's another thing.
Babs is a Gen Xer, I think. So that's pretty impressive. She knows about that.
That is pretty impressive.
That wasn't me. I don't know who said that.
I think that was Janice.
Oh, was it Janice? Okay.
It wasn't me. I didn't know
I'm gonna
that.
pretend to be.
So this is all right.
Okay, well, we're good. So I'll move on. So I'm just bringing back to mind the article that we took a look at when Janice was here the second time, which was in August of this year, and speaking about parent advocacy across the lifespan. So as we know, Janice is here speaking about know where you sit at the table, and from the perspective of a parent advocate. So we looked at the article called Parent Advocacy Across the Lifespan. The citation is there as well as the link to the article. And I think it's not a secret that accessing services for a person who has an intellectual developmental disability is a little challenging. And that might be the understatement of the century, depending on where you are. And if you add a complexity to that, such as a mental health condition or even responsive behaviors, things get a little bit more difficult. At which point, parent advocacy becomes even more critical. Their involvement can make the difference between a person receiving services that are appropriate and not. So this study's main goal was to take a look at how parent advocacy impacts the different barriers and navigation challenges that people who have difficulties face on the path to appropriate services. So one of the first highlights that they make in the article is that at different stages along the path in the lifespan, different advocacy is needed. So they looked at the 4 different stages, which early childhood intervention services, which are typically family-based, then school-based services, transition services, typically around the teenage years in adolescence. And they're still primarily school-based with some outreach into community-based. And then adult services, during which services are frequently fragmented across multiple services, such as employment, housing, leisure, clinical, etc. So what the literature says about impact on parents, I don't think will be a surprise to anybody. It can be a mixed experience for parents, both positive and negative effects of having to advocate or, wrong language of advocating, I guess, for their adult and young child. So in studying focus groups of parents and individual interviews with 104 parents of people with intellectual developmental disability of varying ages, this group, so Wang et al., found that families perceived advocacy as an obligation and a means to improve services. Positive and negative effects of parent advocacy. The benefits, parents found that they developed greater coping skills and potentially access to better and more appropriate services for their child who had an IDD or a dual diagnosis. The negative outcomes, again, not a surprise, increased stress, at times adversarial struggles, so really complex challenges in the path to receiving services, and worsening family and professional partnerships. And I believe that is referring to the toll on families that it takes to advocate for heavy advocacy for a child within the family, and at times fragmented professional partnerships as well. So they did take a quick look at self-advocacy and the obvious statement that the need for advocacy rarely decreases as a person gets older. So typically, as they move further into community services that are fragmented, the need for advocacy increases, where parents of an average child or a typical child, advocacy tends to decrease at that point in time as a child becomes more independent. Through adolescence and adulthood, there's an increase in self-advocacy outcomes. And noticeably, advocacy has been a central tenet in securing civil rights for people who have intellectual disabilities, intellectual and developmental disabilities. The study also took a quick look at advocacy for different cultures and linguistically diverse communities, acknowledged that there was a need for a different type of advocacy within those communities, but that we're still very early on that path to understanding how to foster and assist parents and families to advocate. So conclusions from this study that civil rights are a direct result of the advocacy of parents of children who have an intellectual or developmental disability, but that we do need additional research across the lifespan to determine how it is most successful at different stages. And then to reduce and remove barriers across the lifespan, we need to understand the perspective of the advocate, whether it is a parent or a self-advocate. So that is the basis of the study. And certainly I know Janice will expand on that as we go further along. And to remind you who Janice is, and I know she's going to add some information to this as well. Janice has over 30 years of experience supporting individuals who have disabilities, the last 25 serving individuals with severe and persistent mental illnesses. Janice always says she's fortunate to work at BJC, Behavioral Health, a large community mental health center. In addition to supervising the supported employment program, Janice's role with the agency has expanded to include supervision of entitlements in the disability programs. This has afforded her the opportunities to build upon her knowledge of various programs administered by the Division of Family Support and Social Security. In addition to that, Janice is a critical member of the NAD Board of Directors, and I believe has served on the board now for, oh, Janice, correct me if I'm wrong, but at least 3 years, potentially 4, and is a very valued board member. It's just a pleasure to work with her and a pleasure to hear her share her experiences. And I'm sure it will also be a pleasure to learn a little bit more about her, something that we don't know. So please welcome Janice Wolf.
I want to remind everybody that last time that Janice introduced herself, she told us about being, let's see, accosted within her own home by a man in his underwear. So I'm very anxious to hear what this new interesting fact is going to be today.
Accosted by a man in his underwear who she didn't know.
Yes. Oh, yes. Right. Yeah. Okay. That's a very important detail. I'm glad you added that.
I think so. Yeah, I'm hoping she didn't leave after that. Denise?
So Janice, you're on mute, I'm afraid.
Sorry. His name was Joe. He had folded his clothes and put his shoes under the bed and was going to get in bed with us. I don't think I've told this story, but I'm also the parent of a child with, I just say he has Ethanism. He has multiple diagnoses. He has lots of labels: bipolar disorder, intellectual disability, apraxia, autism. He's a mixed bag, but he is Ethan. And I think God was preparing us for Ethan. When I first moved to Missouri, I'm from Tennessee, but when I first moved to Missouri, I could not find a teaching job, and I ended up working at the Judavine Center for Autism as a job coach. And I supported 2 young men with autism who worked at a Pizza Hut. And by the way, I got Employee of the Month because back in the day, supported employment was sold as you get 2 employees for the price of 1. So I had my own tasks at Pizza Hut. And my husband was an employer. He was a manager at Pizza Hut, and he's an extrovert. He's the perfect dad for Ethan. But he got to know everybody. And I hated him. Hated his guts because I was a professional and he thought he knew everything. He had hired so many of the individuals that Judavine supported. He knew all of them. You know, he just thought he knew more than me. How dare he tell the expert how to do her job. So I hated him. So he started growing on me. We went out. Long story short, we ended up deciding to get married. The young man that I had been job coaching had worked for my husband off and on for years. We took Tony to Tennessee. He was best man at our wedding. So that's how I met my husband.
That's cool.
Love that.
That's a
And
cool
about
story.
25 years later, Tony kind of got married. It was more of a commitment ceremony, and Tom was best man in Tony's wedding.
That's
So we've maintained contact with Tony all of these years. He'll come over, although he is terrified of my son. He's terrified of Ethan because Ethan gets pretty aggressive. Tony is an absolute character. He's like another one of my kids. I just adore him. But so we've maintained, he'll come over and spend the night. So we've maintained a relationship all of these years. But it's been such a privilege, and it's such a neat story.
Yeah, you've topped yourself there. That's a
Yeah.
great story. I love that.
I'm
And-
really happy Tom learned an awful lot after you joined the organization. So to the point where, he was really acceptable.
Well, and my husband truly is the perfect dad for Ethan. And I remember we had an individual we supported that did a lot of self-injurious behavior, and he was probably close to 6'5", and I had never worked with him before. And I was one of the few times I was actually pretty intimidated, and I was about 8 months pregnant, and I needed to go cover. And my husband said, "Oh, don't worry about it. If he starts to escalate, just ask him about his diet," because it was a way for him to de-escalate, and he would start, talking about the years and how much he weighed. And that was my husband, is he just would, he had a passion for working with people with disabilities, and he was just one of those people that, totally walk the walk of integration and support. People should be fully integrated, and he that's I think why we've clicked is, we're a good tag team with Ethan, but he walks the walk. And so that was it was just really cool coming from somebody that didn't work at the agency. You're like, "Oh, just ask me about his diet." He got to know his employees. To him, these were just another one of his employee. He knew how to be a supportive supervisor. So anyway.
That question would trigger me.
Yeah.
That's wonderful.
Anyway, he was exactly right. But I wanted to go back to your Smarticle. And I don't remember the statistics, but a large number of parents and family members also have post-traumatic stress disorder. And I can attest to that. My son is extremely aggressive. I probably have 30 holes in the wall. I've had concussions. The last time we had to call, we always, the first time I was actually on this, we were there to talk about crisis intervention trained police officers. I believe the last time we called, we had 12 CIT officers at our house, because he's a big, strong young man now. But he's very, very violent. And when he gets escalated, and at times, when he's manic and having very classic symptoms of bipolar disorder, it can be very dangerous to be around him. And so that hypervigilance on our part translates into mental health symptoms, post-traumatic stress disorder, things like that. So that's another component that family members often have to deal with. Fortunately, I work in a mental health agency, and I have access to EAP services and rooms full of therapists and mental health professionals, but not every family has that. I also go to a church that's specifically for people with intellectual and developmental disabilities. And I think that's where my heart is, partly because these are individuals whose parents don't have the skill set that I have. And I think that's as professionals, we need to be very mindful that it's kind of a perpetuating cycle. A lot of the individuals that I work with, their parents are also disabled. And so, I feel like that's kind of a calling too, is to step up and advocate for people who don't have good advocates. A lot of people, their parents may be afraid to ask for case management services. And so checking with people to make sure they're living in a safe place, that they're not being abused. And so, we have families that are involved, but there are a lot of individuals who are disabled that don't have families who are able to access services or be good advocates.
Janice, we did get one question that says, what treatment modality have you used for your PTSD?
I haven't, I take Valium and Prozac. I have 3 other children, and I don't think at this point I've really had time to slow down. I will tell you that I have not been alone in my house since Ethan was born. Maybe honestly more than a couple of hours. We've had um, personal care attendants, we've had BCBAs, we've had every type of service provider. Actually, we've been afraid to leave them alone with Ethan. There have been a handful that were not intimidated by him. I used to give myself 1 day a year, usually it was IEP day, to grieve and mourn. I don't do that anymore because now, it is what it is. And so I really don't let I feel like I don't need to be sad about it. I am hyper vigilant and I duck all the time when he comes near me. If I'm sitting on the couch and he's coming down the hall, I automatically cover my head because he has just beaten the crap out of me.
Yeah.
He's been approved for a comprehensive waiver, which will pay for residential services. And I think everybody's aware there are no service providers. There's just such a staff shortage that we've been in holding pattern for over a year now, waiting for any agency really, to have staffing to accept him. I have utilized EAP. So it's been helpful to talk about it. But at the end of the day, it is what it is. I have my mother living with me now who has Alzheimer's. I have a great support system with my friends, my husband. I think one day when I'm in the eye of a hurricane, and I think when it eventually settles down, I will probably collapse and cry for a while. I've been blessed with a really good sense of humor, which I am so thankful for because we can always laugh afterwards. One of my favorite stories, I walked into the bathroom and Ethan, who's nonverbal, which that's kind of beside the point, was holding a plunger and an empty container of diaper wipes. And my husband, of course, was out of town, and Ethan loves vacuum cleaners. So I called his teacher at the time and I said, I would really like to take credit when you see him. I would really like to take credit for this, but I can't. He flushed a whole container of diaper wipes down the toilet. And now, cut to the chase, we have a foot of raw sewage in our basement.
Oh,
And in his euphoria of the mother of all vacuum cleaners coming into our house with Mr. Roto-Rooter, he danced out of the kitchen and took a header onto the patio. So he's one giant scab on the side of his face. I wish I could take credit for it, but it was him. It's just constantly,
Mhm.
I needed to go somewhere one time. I needed to teach Sunday school. And there was no one to keep Ethan. I was like, hey, buddy, we're going to go. Nope. It's like, come on, you're going to go see your friends. Nope. And he knew he had me over a barrel. And my life is constantly like that. I can't just pick up and go to the store. I can't just go anywhere because he controls everything in my life. And it's like this for other families too. But at the same time, I am aware that most of the time he's pretty funny and he is healthy and there's so much to be thankful for. And so I think choosing to be happy and choosing to laugh about things after the fact has been my saving grace. There are a lot of people that would like to have my problems.
You're talking about the sense of humor that is the only way you can get through a lot of these things.
It is. You know, we were laughing the other day about Thanksgiving. He's ruined every holiday we've ever had, but the memories now are funny. It's not funny at the time,
Yeah.
but he ruins it every year. But the last time I was going to fix 2 egg custard pies, and I ended up on the floor completely covered with raw egg custard. And all I could do was laugh and say, boy, it's a lot of egg. But
Yeah.
it's always something like that. And,
Mhm.
you know, you can either laugh about it or cry about it.
Mhm.
There was a time I would have cried about it, but now, you know, it's
In
choosing to
retrospect,
laugh.
these things get funny, but at the
Yeah.
time, no,
Yeah.
they're very
And-
stressful and very difficult to deal with.
And you know, when we started out, and I think for families, I absolutely went through the stages of grief. And then when I got to the point where I could accept it, the rest of my family had accepted it. And when he was little, my mom got really, really mad at me because all of the cousins and my other kids got Happy Meals and Ethan didn't get one. But he couldn't have cared less about the Happy Meal. But it was the point that I wasn't treating him the same, because if I didn't treat him the same, he wasn't going to be the same. And we were at the mall, and my sister has PTSD from this, because we were at the mall and I didn't get Ethan an ice cream cone. And I said, Mom, Ethan doesn't want an ice cream cone. Well, you didn't get him one. How do you know? And so I handed Ethan my ice cream cone, and he threw it all over this lady's very expensive coat. And I walked one way and my mom walked the other, and my sister was there. And you know, the ice cream places give you those little teeny tiny napkins. And so my sister was left trying to clean this woman up. But,
Yeah.
you know, I think when families start off, you go through that. And it's every stage of grief. You know, I was thinking, I took a bath when I was pregnant. You blame yourself for everything. You go through every possible thing you could have done to cause this. And
Mhm.
it is, you have to reset your dreams for your kid. And you have to work through all of that. And now I'm to the point where he has Ethanism. He is who he is. I have new dreams. At the same time, we were on top of everything. You know, we put him on wait lists for day programs when he was in, you know, we've had the backup plan for, you know, which agency was going to get him when he got older. And here he is, 25 years old, sitting at home every day. There's not enough services for adults. So with all the planning and being a professional working in the field, you get to be adults. And, you know, if anybody was going to have their kid ready for transition and adulthood, it should be me. And the reality is I've got a 24-year-old man sitting at home every day in his underwear.
Yeah, the system
Won't leave
stops.
the house.
Yeah.
I'm curious, and we've got several comments. I'm gonna let Babs get to those in just a second, but you know, I think a lot about this in the work that I do, kind of balancing between acceptance and change. Big DBT principle, you know, looking at this continuum between acceptance and change. And, you know, it occurs to me as you're talking about a lot of what you're talking about, that acceptance is really an important part of what's helped you deal with all this is some acceptance of the circumstance that you're in. And maybe realizing at some point that you're not going to be able to change all of these things that are going
Yeah, absolutely. And accepting Ethan for who he is. You know, our other kids sacrificed a lot, but they're such good people now as a result. And I think, you know, looking for the good in the situation, my faith has definitely been very helpful. But I think the main thing for me, because I am a professional too,
Right.
has been advocacy. I think that's been what's helped me the most. And I shared this the last time. Um, NAD is the one place where I'm not the professional. It's where I am the mom. I try and help take care of the individuals with disabilities. I try and train our new staff here at the agency where I work. I ask to do the new employee orientation so that they can understand um, it's consumer advocacy. So they understand what it's like to be a consumer or the family member or the caretaker, what that perspective is like. But I remember hearing about NAD at a conference I went to. And so I looked online and checked it out. And we were stuck, I guess it was Ethan's third hospitalization. He was stuck on a surgical floor because nobody wanted to take a dually diagnosed kid. And I remember emailing Dr. Fletcher, who at the time was the CEO of NAD, because they were actually looking in Illinois. We live in Missouri, and trying to find a placement. Twice he was stuck on a surgical floor at our children's hospital, trying to find a placement, which just didn't exist. His first hospitalization, actually, we took him where the psychiatrist said to take him, and the next day they called and said, "We're not equipped, come and get him." And it took us a lot to get to that emotional place where we could call and take him to the hospital, and we weren't prepared. We got him there. You can't go back on the unit, can't have shoelaces, can't have any belts, nothing with strings. And they're taking my nonverbal child who has never been away from me back on a unit where I can't see him. It was awful, 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 awful. And he was 9 years old. He's had multiple hospitalizations since. And most of the time, it's been very obvious that they didn't want to take him.
Yeah.
Very obvious. And to leave your kid someplace where he's not wanted is a terrible feeling, but the alternate is having him at home where it's completely dangerous. I mean, when he's escalated, and I don't think staff understand that when someone is escalated with the adrenaline going, my husband and I together have been unable to hold him down. And there's the 3-hour tantrums, but he has all the classical symptoms of bipolar disorder. He gets hypersexual, he gets super manic, he stops sleeping, he has the mood swings. And then I've been on the phone with mental health professionals that say, well, he has an autism diagnosis. And I would say, but I've worked in the autism field. I work in the mental health field. I can tell the difference between a behavior and a mental health symptom. And I don't think you would say this to the parent of someone with a mental health symptom. And his psychiatrist also knows the difference between a behavior and a symptom.
Mhm.
And so these conversations are so frustrating. So I think that's also where good documentation can be very important. RAP plans, wellness recovery action plans are helpful. When he has been hospitalized, I take pictures because people assume he's at a baseline. It's like, no, this isn't his baseline. Look at this picture. This is what Ethan is. This is how he looks. So things like that can be very helpful.
Janice, I'm very curious because I think some of the experiences you're describing with professionals are certainly horrific and shared. I think, unfortunately, by many parents and families. But you've spoken, and when we spoke initially, we spoke about the training program that you have for staff and helping them to understand the perspective of families. And I'm really intrigued about that training and how that could make such a significant difference to families' experiences, for the experience of the person with the intellectual developmental disability, but also for the family. Can you speak a little bit more about that program that you developed?
So it's I have a PowerPoint that I use, but really, I tell stories about some of the families I've worked with. One of the, it's easy to get really irritated with families. I certainly am a family member, but one of the stories that I think is so important for staff to understand, this is one that really illustrates it well, I think. There's a gentleman that I've worked with off and on for years, and we helped him get a job. And we've helped him get quite a few jobs, actually. And he had a job that was actually a pretty good job placement, but he called one day because it was snowing and he had ice on his windshield. So he called me just furious because there was ice on his windshield. I'm like, you're a 40-year-old man. I have to go to work. I have ice on my windshield. And I had a great relationship with his mother. We had a wonderful rapport. But then she called and she was really mad because he had ice on his windshield and he had to go to work. And she was mad at me. And I thought for a minute, listen, lady, you're being completely unrealistic. But then I thought for a minute, her life is perpetually walking on eggshells and waiting for that other shoe to drop. And when when that eggshell starts to crack, her worst fear starts to come to fruition again. And she will do anything in the world because he's taken her to hell and back. And she's reacting to him, not to me. And she will do anything to keep from going back to hell. And I know that because I have thought many times, Lord, I can't do this again. I cannot go back to that dark place. And that's what staff need to understand. They're not crazy parents. I'm not a crazy mom, but I have been to hell. I have looked, I've been around individuals. I have a good friend who has two very mentally ill daughters, and one was so psychotic, it was almost like being in the room with the devil. And what these families go through, I wouldn't wish on anyone. Ethan got fast tracked to the comprehensive waiver. He's, incredibly aggressive. And I joke with the service coordinators, just really having that case manager to help us maintain some kind of perspective is helpful, because if he has 2 or 3 good days, we're like, oh, everything's fine. We don't need a waiver. We don't need everything, because my last name is Wolf. We call him wolf years. A wolf year can be 3 days. It's like, oh, everything's on track now. We don't need any help. He's good. He's good.
Yeah.
Really, it's just been 2 or 3 good days. But I have no perspective of time, but if you were on the outside of my house looking in, you would think we were completely crazy. That's just how it is.
But
we have an absolutely wonderful psychiatrist. We've been through 6 other psychiatrists. We had one that wouldn't let Ethan in his office. He would only see him in the hall. People that will just treat what they're seeing in the office. So, it's a partnership. We and for those, if you weren't at the last presentation, I call my presentation with staff, know where you sit at the table, because when we've gone into staffings and meetings, we've had case managers and service coordinators that sit next to us. And that is the most powerful, meaningful form of support that I can convey. We've been at meetings where people sit across the table and it's so adversarial and so uncomfortable. But those that sit next to us, that support is invaluable. So I always encourage staff, be the one that sits in that seat next to the person that you're there to support.
That's a great tip for our clinicians out there. One of the other things I wanted to point out, we've got several parents and family members on here. I noticed Janet Schaus was showing her camera here because she's had some similar experience. And I just thought, maybe Janet, did you want to jump in and make a comment or ask a question?
Well, I was just going to say, you must be a born optimist if 3 good days make you think everything's cool and you don't need waiver services. Because my situation sounds very mild in comparison to yours. My son's meltdowns while they're really intense, seldom last more than about 15 or 20 minutes. And they are pretty intermittent. And he is in 24 hours supported living. We reached a crisis stage when he was 19. It took us 2 years to find an agency willing to support him with his behaviors and near us. But because he takes a PRN medication, he needs to live near us because the staff can't give the PRN med. But I just want to reach out and hug you
Thank you.
through the camera. And because I'm a problem solving kind of person, I honestly am sitting here thinking, okay, what meds are he on and what's worked and what hasn't worked? And let's brainstorm and see if we can figure out something.
He takes 12 pills twice a day, and then some others. He gets manic on Thorazine. He gets manic on pretty much everything. But we went through 2 or 3 years where he had 4 or 5 psychiatric hospitalizations. So we went through a really, 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 really bad time. And getting him hospitalized was really hard. So compared to that dark, bad time, I feel like this is, and my mom's moved in with this and she's like, what are you guys going to do? How are you going to do it? I'm like, Mom, this is nothing compared to what it was like. We can handle this. So I feel like we're in such a much better place than we've been that, and again, it's not perspective, it's relative to where we were, that, if you were outside looking in, you'd think we were still crazy, but it's so much better than it was. And honestly, the last psychiatric hospitalization was pretty much a disaster. He was there for 8 weeks, and they, anytime he moved, pretty much they were giving him PRNs. He has such a funny, vivacious personality, but we literally had to carry a towel down. He was just drooling, and it was unbearable to watch. And they wanted to put him in on a locked unit, put him in a, facility. And thankfully we, persisted. We didn't do that. He's now gonna, once they're staffing, gonna go into a house with a roommate. I think he'll do much better when he doesn't have mom to, I'm mom. My other kids take everything out on me too, but, it's just like any other person with bipolar, it's cyclical, you adjust the meds. We have a fantastic psychiatrist. I wish there were step down units and psychiatric day programs like there are for people with just regular mental illness where we could do a medication adjustment. That doesn't exist. If you go into a regular psychiatric facility, and this is the excuse for not admitting a lot of the dually diagnosed individuals, is they can't participate in therapy. It's such a huge discrepancy. They don't do any kind of behavior therapy or occupational therapy. So it's hard to gauge what those behavior, what is a behavior, what is a symptom. So, inadvertently, a lot of the bad behaviors get reinforced. So, the hospital situations are, NAD, and I'm not saying this because I'm a NAD member, but NAD really is stepping up and jumping into some really, really important grants and educational programs, and it was really taking the lead. And I think really, really going to make a huge impact in this area because it is such a important, to me, this is where the biggest deficit is getting treatment for the adults like Ethan that need that crisis intervention. Because right now, we sit at home and he probably does need to go to the hospital sometimes, but the option would be going and chasing him around a small hospital room, letting him beat us up, If they, we took him one time and they gave him so much sedation, he ended up in ICU and restraints because they didn't know how to sedate him accurately. And then even if he does get admitted, which that's a crapshoot, the odds of him actually getting treatment are pretty slim. And he's so upset about being in the hospital, and they're not managing, doing anything therapeutic except giving him PRN medications. And the criteria for discharge the last time was going for 24 hours with a PRN shot. So I don't know that I would, even if there are times I think he will kill me. The aggression is to that level, but I really don't know if it's worth even trying to hospitalize him again.
Mhm.
They've sent him home saying he's stable, you can take him home. And I'm like, really? He's not stable and it is so dangerous. Well, he can't benefit from therapy, so we're not going to admit him. But if he gets dangerous, call 911. So,
Yeah.
Yeah.
I have a question about this too, because because you've had to go back. You're talking about being at the table. You've had to go back to the table numerous times because of these things, and here's another meeting that you have to go to. I just wonder, as a parent advocate in this type of situation, do you ever find it difficult to want to engage in that process again? I mean, does that in some ways become a difficult situation for you to deal with, or how have you dealt with that?
well, I think education certainly, and I'll tell you, and again, I'm not I'm not trying to promote NAD, but early on,
Okay, though,
I
we will
was
accept the
think it's
promotion.
fine. Mhm.
Find that
early on,
acceptable.
I was on some kind of a group, and I was introduced as the parent of a rare individual. I honestly, I'd never heard the term dual diagnosis. And I was doing some research, and knowledge is power.
Mhm.
And I went to my first NAD conference and I was like, holy cow, I've got all of these statistics now. And so I was able to go to a meeting and throw out statistics. And I had these resources at my disposal. And not only did that help, but it made me confident.
Mhm.
I'm not as well educated. I'm not a clinician, and I have to go into these meetings with these clinical directors and people like that that don't want to help. You know, it's gotten a little bit better, but there are still a lot of people at the Department of Mental Health that don't believe people with
Yeah.
IDD can have a co-occurring mental illness. And I've met a lot of them.
Yes.
But being empowered with knowledge and support makes a huge difference. Now, at the same time, because I have been a service provider for a lot of years, I feel like it's not playing the game, but I know how to, I call it the power of the partnership. And so I'm very mindful. I know that there are more limitations than some parents realize. I know the goal of the service provider is not to fix the kid. It's not to do my job. Their job is to help me have the skills to work with my son. So I'm very mindful when I go in not to make it a militant or combative situation. So I want very much to make everybody feel comfortable, and I'm very appreciative. So I work very hard to make it a team effort. We had wonderful relationships with Ethan's teachers, and I would ask for their opinion because I view it as a support team, and I make sure everybody knows that you are part of Ethan's support team. These are team decisions, and I work very hard to make sure everybody is appreciated and comfortable, and we can avoid a lot of that combativeness, because I think parents can get really it's tricky when you go in there making a lot of demands, and the expectations are, you're going to do this, you need to fix my kid, you need to get me this, and
Yeah.
this. And I know as a service provider, I know how the funding works. I know some things just are not possible. And I do feel guilty sometimes because I know Ethan has access to a lot more than a lot of kids, adults that maybe don't have come from the same situation.
Mm.
So, you know, he's one of the haves, and there are a lot of have-nots out there.
I have a quick comment and then a question if we have the time. I just, I absolutely have to say you have demonstrated completely why I love to see your face in meetings and at NAD. I think the information, the experience, your energy, and your attitude are such gifts that you bring to NAD. And I'm confident to your work and to your family that it is invaluable. You bring the perspective that we need to hear. It's so easy to forget who is on the other side of the table because I would say that more often than not, people don't notice where they're sitting. They don't notice where they're sitting. I have been fortunate enough to have a family teach me that early on in my career. And I know where I sit. So I sit with who needs me. But I'm wondering if you have, even if it's just one piece of advice from a parent's perspective to the clinicians, the service providers who are in attendance about how we can make this process a less contentious potentially or less combative experience and a more cooperative experience, us even in just how we communicate or sit. What is it you would pay for us to do differently?
Well, and I think I said something similar the last time. Authenticity to me is the where we've had the best relationships. I don't expect people to be experts. The ones that have come in and, you know, we had someone that said, well, Ethan likes SpongeBob, so I'm going to give him a SpongeBob sticker. Ethan couldn't give a crap about a SpongeBob sticker. People need to listen better. You know, it's coming together and that mutual respect. But I'm an irreverent person, and you know, the people, we have a great relationship with the BCBAs, and you know, we had a new one start day before yesterday at Tech, and my husband was joking to the BCA. He's like, did you warn her about me? Because we joke around a lot. That's our personality. But I think, and it goes for parents too. But just being able to be authentic and having that relationship is so important because it's an invasion of privacy. We have zero privacy in our lives.
Mhm.
We were hotlined by a hospital because we refused to pick Ethan up. So now it's in every record that we were hospitalized. The hospital said, "Oh, he's perfect. Come and get him." It's like, he's not perfect. You've changed his meds. We don't know if they're going to work. You've called a code on him every day. You're giving him PRNs. It's not safe for me to pick him up. So we got hotlined. So now every service plan says that I was hotlined. I have no secrets in my family. I have opened up my life to providers, service coordinators, case managers. Please reassure people that you're going to be protective with that information. Be authentic with them. You know, it's, I don't even know how to say it, but it needs to be, it's an intimate relationship. It needs to be a mutually trusting relationship. It authenticity is the
Respectful.
best word. Yeah.
And respectful.
Trust.
Let your
such a
guard down a little bit. If I have to let my guard down around you, let your guard down around me.
Mhm.
If there's
You
not
feel
that
so
trust there,
judged.
if you don't have that trust there, whatever you're trying to do is going to be ineffective.
Mhm.
It really
we
has to
started-
start with
Yeah.
that relationship that you're talking about. And I don't know, I've never used this term, but I have heard it used before. People talking about the parent from hell. I'm sorry to expose that to people if they haven't heard that before. Yes, Janet is probably one that's been described that way before, not by me. I want to make that clear.
Oh.
But
Hey, I'm a full-fledged
just
member
joshing
of the
around a
Mother
little
from
bit about
Hell
that.
Club.
the point I'm making is that, look, and what you've done a good job of sharing, what Janet has shared a lot over the course of time that I've known her, is, look, understand my experience, understand what I've been through to get to this point that we're at. And this is not the first meeting that I've had to go to about this stuff. And so I think clinicians have to be cognizant of those things as they're stepping into these situations.
We
And
started
working with
with
families.
First Steps, and he had every occupational, physical, speech and language. And boy, I scrubbed my house every night before they came over. And they were so mindful, and I'm so thankful. And they engaged our other kids and just were delightful. And that made such a big difference. I had a psychiatrist say, well, your other kids are fine, so clearly it's not you. So, you know, but I will tell you, one of our best psychiatrists, I was upset, and she said, you and Tom are my role models. And I said, whether or not you mean that, thank you for saying it. Be generous with your words. It can, it's so
Right.
important. Just, being generous with your words can really make a difference.
Yeah.
Mm-hmm.
So encouraging. This is such an encouraging message that you've given today. And I just want to say thank you so much for coming on and sharing your story so openly. I do feel like a lot of the parents that we have on here are probably really benefiting from what you've said, because so many times you can feel all alone in this. And to know that there are other parents out there who are dealing with the same thing and connecting with them, I think is something that can make a huge difference for people. Janice, I just appreciate you so much for coming on and talking to us about all this today. It's been wonderful.
Mm-hmm.
This is a highlight for me. And, one more plug for NAD, that being on the board of directors for NAD is truly one of the honors of my life. And
you're going to help me get those
for
100 people from Tennessee to the NAD conference this year. That's my goal, because Minnesota, I've
I owe a
already
lot.
heard, has 100. So I'm shooting for that as the goal for Tennessee this year.
I do owe a lot to NAD, and I'm a professional. My therapy is taking care of other people. NAD is where I'm a mom. So
That's great.
and if it's not NAD, I would encourage people to have a support team. If you're a parent,
Well,
find
and
your
they
support
could
team.
get involved in NAD. That's a great way of getting that support. So I would encourage that. But this has been great. I appreciate my co-host, Juanita St. Croix, our producer, Babs Tierno. Of course, we appreciate you, Janice, for being here. Appreciate all of our guests. I hope everybody will have a happy Thanksgiving this week, and do give thanks. It's really one of those things that can help you with your own mental health if you're grateful for things that are going on in your life, despite all the difficulties you may experience with different things. If you can be thankful, then everything seems a little bit better. So I just encourage you all in that regard, and happy Thanksgiving, and we'll see you next week.
Happy Thanksgiving.
Thank
You're almost
you.
making
This
me
has
cry.
been a privilege.
Thanksgiving.
I appreciate it.
Thank you, Janice.
Thank you so much, everyone.